All right, number 18. Got a patient with irreversible absence of brainstem and cerebral reflexes. What can you say? That is brain death. And a brain dead patient, can they spontaneously move their limbs? Yes. ESR is a screening test for what sort of arteritis? Giant cell arteritis. What is considered infertility? An inability to conceive greater than or equal to 1 year or 12 months is infertility. What is the genetic inheritance pattern for hemophilia A? It's X-linked recessive. What's the equation for number needed to treat? Number needed to treat equals 1 over absolute risk reduction, and absolute risk reduction is the risk in the exposed minus the risk in the unexposed. An elderly person with unexplained bruises and injuries, what should you consider? Consider elder abuse. How do you treat oral candidiasis, aka thrush? Treat oral candidiasis with nystatin suspension. If you suspect osteomyelitis in your orthopedics clinic, what should you get? What sort of imaging? Rupert, go right there. Come on. Come on. Get an MRI. If you suspect osteomyelitis after the MRI, what sort of diagnostic test should you get? A bone biopsy and cultures and sensitivity. What are the 3 things for Meniere's disease, that triad? Vertigo, hearing loss that is unilateral, and tinnitus is for Meniere's disease. What treat can cause hypertension, hypokalemia, metabolic alkalosis because it inhibits the conversion of cortisol to cortisone? Licorice. Licorice can cause hypertension, hypokalemia, metabolic alkalosis. Is bereavement normal grief? Yes. Glucose and protein in the UA of a pregnant patient, what should you consider? Gestational diabetes mellitus. If you see a weird finding, what should you get? Like a weird finding on a skin, get a biopsy. You have someone comes in, they haven't had their measles, mumps, or rubella vaccine. What should you do? 99.9% of the time, give the vaccine today. So you have a patient and they have essential tremors, aka familial benign type, without a real issue. So is that going to be a big problem for them? Nope, not a big problem. And what is the medication used to treat essential tremors? Propranolol. Propranolol treats essential tremors. And you have a patient with neurofibromatosis. What sort of exam should you do? An ophthalmologic evaluation, right? If you have a crazy, just wild acting out patient in the emergency room, what medication can you use to get this aggressive person to calm down? It starts with an H. Haloperidol, right? Haloperidol. If you have a patient that passes the stamp test at night, you know what sort of dreams they're having, their concern is with ED, what sort of consultation should you get for this patient? Get a psychiatric consult, right? Psych consult. You have a patient who has been taking SSRIs. So how long should they take them to see if they work? Approximately 6 weeks, right? 6 weeks to see if your SSRIs work. You have a patient who has findings concerning for depression, but they drink and smoke. So what should they do before you reevaluate them to see if their depression is real? Stop drinking, right? Obviously. Because the diagnostic criteria says that the person shouldn't be drinking or on any sort of medications um, before testing them to see, or doing your interviewing to see if they have a psychiatric issue. Okay. You have a patient coming in, they're trying to get some stuff for their job, to take a leave of absence or substance. And then the employer calls you. So what sort of information do you give them? As little as possible. You don't want to get sued for HIPAA, right? All things, HIPAA is the stupidest thing to get sued for. Since HIPAA is present, give the employer as little info as possible. What is a common cause of necrotizing fasciitis? Group A strep. Group A strep is a common cause of necrotizing fasciitis. Necrotizing fasciitis, what sort of treatment do they need? Necrotizing fasciitis needs urgent surgical debridement and antibiotics. Stat. You have a healthcare professional that is in contact with HIV fluids. How should you treat them? Treat the healthcare personnel that's been in contact with HIV fluids with a combination antiretroviral therapy for 4 weeks. You have a patient and you want to monitor the patient with solitary pulmonary nodule with interval CT. If SPN greater than 0.8 centimeters, you should do a what? A biopsy, right? If you want to make a diagnosis of uncomplicated urinary incontinence, all you need is a history, physical, and UA. Is that true or false? That's true. To diagnose uncomplicated urinary incontinence, just need a history, a physical exam, and a UA. Now, if you have a positive CT for a lung cancer screen and you see a non-calcified nodule, the likelihood of having lung cancer is what? It's less than 10%. And note that that non-calcified nodule can be greater than or equal to 4 millimeters. Interesting. How do you treat trichomonas? With metronidazole, right? Treat trichomonas with metronidazole. A lung unit with low VQ ratio needs improved oxygenation. Is that true or false? That's true. A lung unit with low VQ ratio needs improved oxygenation. For type 2 heparin-induced thrombocytopenia, you want to wait for platelet count recovery before starting what medication? Warfarin, yep. For type 2 heparin-induced thrombocytopenia, wait for the platelet count recovery before starting warfarin. If you have a patient with ventriculomegaly, what should you do as an initial first step in the treatment? Drain the CSF, right? If you have a patient and you suspect rheumatoid arthritis, what should you order? What medications? Well, yeah, get a rheumatoid factor and give ibuprofen, right? If you have a patient with rheumatoid arthritis that can benefit from a medication, what is that particular medication? Methotrexate, right? Patients with rheumatoid arthritis can benefit from methotrexate. And if they're on methotrexate, what vitamin supplementation should they receive? Folic acid is a supplement for people with methotrexate use. And if you have a patient who is who has C. diff, in order to treat it, what sort of C. diff do they need? Asymptomatic or symptomatic? Symptomatic, right? You don't treat asymptomatic C. diff. And what sort of suppression increases the risk of C. diff? Gastric acid suppression increases the risk of C. diff. You know,